It's that time of year again. The leaves have fallen. Time to roll up our sleeves and brace ourselves for the understatement of the year. This'll only hurt a bit. Yes, it's flu season.
When we talk about flu in this time of year, we're talking specifically about influenza.
Flu is a virus.
It affects your respiratory system.
And then you end up with a fever,
Everything from your nose to mouth, throat, down into the lungs.
sore throat,
Muscle aches and pains,
nasal congestion.
runny nose.
Combined with regular hand washing or sanitizing, the island's medical health officer says the flu shot is the best way to protect yourself and others from this virus.
According to Health Canada, each year anywhere from 3.4 to 8.6 million Canadians come down with the flu. And although for most it's just a nuisance, for some it can have serious consequences. Between 2,000 and 8,000 Canadians die each year from the flu.
Dr. Hoyano says that people with chronic health conditions like lung disease, diabetes, or cancer, as well as seniors over 65, children under 5, and pregnant women are most at risk of potentially life-threatening complications from the flu.
And then people who are in close contact or work with people who are, have those potentially high-risk conditions.
Dr. Hoyano says the BC Medical Health Office is convinced that the flu shot helps reduce the spread of the virus. And this year, healthcare workers must either get immunized or put on a mask during the flu season.
It's really to add that extra level of protection for people who are in hospital or healthcare facilities.
But not everyone is convinced that flu shots are really all that effective. Drug policy researcher Alan Castle says he's skeptical.
So I'm really interested in how well is the program going to be evaluated? Will they actually reduce the rate of flu infections and save people from complications and deaths and so on? And my sense is they're not actually collecting the appropriate data to determine those questions. So at the end of the day, we're going to spend $8 million and possibly not even having an answer whether that money was well spent or not.
So I might get the flu anyway, but at least I have the freedom to choose, and I can practice prevention. How I wonder what you are. The Public Health Agency of Canada suggests that you lather up for at least 20 seconds. To get your kids to do it, have them sing a song. Right now, Shoppers Drug Marts are offering free flu shots by walk-in or appointment. Omar says get your shot early. It takes about 2 weeks for the vaccine to become effective, but it lasts for 6 months. And side effects to the vaccine, he says, are rare.
You can get some soreness, redness, and swelling at the site of injection where the flu shot is administered. Number 2 is you can get a low-grade fever, so a slight fever. And number 3 is you can get some slight muscle aches and pains.
This will only hurt a bit.
At the Uptown Shoppers Drug Mart in Saanich, I'm Paul Beilstein.